Chronic obstructive pulmonary disease, COPD, refers to a group of lung diseases that block airflow and make breathing difficult. Emphysema and chronic bronchitis are the two most common conditions that make up COPD. Chronic bronchitis is an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. Emphysema occurs when the air sacs, alveoli, at the end of the smallest air passages, bronchioles, in the lungs are gradually destroyed. Damage to your lungs from COPD can't be reversed, but treatment can help control symptoms and minimize further damage. Symptoms of COPD often don't appear until significant lung damage has occurred, and they usually worsen over time. For chronic bronchitis, the main symptom is a cough that you have at least 3 months a year for 2 consecutive years. Other signs and symptoms of COPD include shortness of breath, especially during physical activities, wheezing, chest tightness, having to clear your throat first thing in the morning due to excess mucus in your lungs, a chronic cough that produces sputum that may be clear, white, yellow or greenish, blueness of the lips or fingernail beds, cyanosis, frequent respiratory infections, lack of energy, unintended weight loss in later stages. People with COPD are also likely to experience episodes called exacerbations, during which their symptoms become worse and persist for days or longer. Causes. The main cause of COPD is tobacco smoking. However, in the developing world, COPD often occurs in women exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes. Only about 20% of chronic smokers develop COPD. Some smokers develop less common lung conditions. They may be misdiagnosed as having COPD until a more thorough evaluation is performed. How your lungs are affected. Air travels down your windpipe, trachea, and into your lungs through 2 large tubes, bronchi. Inside your lungs, these tubes divide many times, like the branches of a tree, into many smaller tubes, bronchioles, that end in clusters of tiny air sacs, alveoli. The air sacs have very thin walls full of tiny blood vessels, capillaries. The oxygen in the air you inhale passes into these blood vessels and enters your bloodstream. At the same time, carbon dioxide, a gas that is a waste product of metabolism, is exhaled. Your lungs rely on the natural elasticity of the bronchial tubes and air sacs to force air out of your body. COPD causes them to lose their elasticity and partially collapse, which leaves some air trapped in your lungs when you exhale. Causes of airway obstruction. Emphysema. This lung disease causes destruction of the fragile walls and elastic fibers of the alveoli. Small airways collapse when you exhale, impairing airflow out of your lungs. Chronic bronchitis. In this condition, your bronchial tubes become inflamed and narrowed and your lungs produce more mucus, which can further block the narrowed tubes. You develop a chronic cough trying to clear your airways. Treatments and drugs. A diagnosis of COPD is not the end of the world. For all stages of disease, effective therapy is available which can control symptoms, reduce your risk of complications and exacerbations, and improve your ability to lead an active life. Smoking cessation. The most essential step in any treatment plan for COPD is to stop all smoking. It's the only way to keep COPD from getting worse, which can eventually reduce your ability to breathe. But quitting smoking isn't easy. And this task may seem particularly daunting if you've tried to quit and have been unsuccessful. Talk to your doctor about nicotine replacement products and medications that might help, as well as how to handle relapses. It's also a good idea to avoid secondhand smoke exposure whenever possible. Medications. Doctors use several kinds of medications to treat the symptoms and complications of COPD. You may take some medications on a regular basis and others as needed. Lifestyle and home remedies. Unlike some diseases, COPD has a clear cause and a clear path of prevention. The vast majority of cases are directly related to cigarette smoking, and the best way to prevent COPD is to never smoke or to stop smoking. If you're a long-time smoker, these simple statements may not seem so simple, especially if you've tried quitting once, twice or many times before. But, keep trying. It's critical to find a tobacco cessation program that can help you quit for good. It's your best chance for preventing damage to your lungs. Occupational exposure to chemical fumes and dust is another risk factor for COPD. If you work with this type of lung irritant, talk to your supervisor about the best ways to protect yourself, such as using respiratory protective equipment. Living with COPD can be a challenge, especially as it becomes harder to catch your breath. You may have to give up some activities you previously enjoyed. Your family and friends may have difficulty adjusting to some of the changes. It can help to share your fears and feelings with your family, friends, and doctor. You may also want to consider joining a support group for people with COPD. And you may benefit from counseling or medication if you feel depressed or overwhelmed.